and large, in thinking about my commitment, interest in, this topic of leadership and sort of interest in sort of bringing along leaders in the MCH field, I think what's been sort of fundamentally important to me is people who invested time in me. And, now in retrospect, as, I'm a mature, seasoned professional, I can see the risks they took, in giving me opportunities that I never would have imagined, and that were real. I suspect they didn't know how stretching those opportunities were, but or how great the risk they might have been. But the confidence and the trust that they had in whatever they saw, to take the time to teach and give me enough tools to be successful with those stretch opportunities, which in turn built a confidence of somebody who, came from a small town, small high school, I don't think I knew what public health was when I graduated from high school. Maybe not even college, I'm not sure. But in any case, having just person after person give me that is just, I've been phenomenally lucky. And some specific organizations allow that. My first professional job was there was a woman director who was a psychologist, and she was just a dynamite. I think I was lucky to have a woman boss, my first job. But anyway, it was a multidisciplinary training team. So I got that sort of working together across disciplines training right out of the graduate school box, and a lot of openness to just doing things differently. Of course, that was, the early 70s, so lots of people were open to different, all kinds of different, but in coming into public health, actually, I was hired by a state maternal and child health special needs program right at the time that Ronald Reagan was elected, came into office, and the director who hired me was president of the Association of MCH Programs at the time. So they were in a crisis mode. The Title V program was in crisis mode. There were low resources, everything was cut, and he had sort of somebody who didn't otherwise have assigned duties. It wasn't a nurse, and I had this sort of generic background, so I could be assigned to do things. And so, I got opportunities thrust out of that. And then working for the Association of MCH Programs over the years, just having just so many wonderful people, a number of whom we've taped as part of this leadership thing, but and again, it was a matter of the gift of their time in teaching, and like Vince Hutchins and others. But so anyway, too much, is given, much is expected, and so I try to live up to that.
Yeah, it seems like that's a real theme, though. I mean, in terms of people development, having somebody who let you spread your wings, that believed you could do it, that was going to let you make a mistake, and you performed. So, that gave you probably more leeway, I think. And so that's really, I think, an important theme.
The time and the passion, too. I mean, that communication of that passion around an issue, too, I think is very important, too. That sticks with you.
I think leadership opportunities and giving people the opportunity for shared leadership is really important. Working with people who don't necessarily mind who gets the credit and lets members of the team really succeed, and invests in making sure that everyone has what they need to do well. I think that's really important.
And providing a safe environment to allow yourself to ask questions and take risks. I think that's an important part of the whole developing people process as well.
There's a subtle one that many of us don't speak by its name, which is being an ethical person in an ethical organization. But we demonstrate it, hopefully. We show, we role model that there are ways to do things, that there are ways to speak truth without necessarily hurting the other person. There are ways to keep confidences without seeming to be cold and distant. And when people, especially in my observation, have been new to supervision, one of the things that happens is that there's a drawing in, like, I have to be in control, and I have to not tell everything I know, and I have to keep my feelings tight in. And that is not what most people need. That is not what most people want to be around in a work setting or probably in their personal lives. And the ethics of being true to yourself while at the same time keeping confidential what must be, sharing reasonably what is truth, and also taking risk, as you mentioned, when it's appropriate and the balance has been evaluated.
Mhm.
You know, we talk about the dreaded CLM, the career limiting move, and most of us try to avoid career limiting moves. Sometimes an issue will arise where you need to speak a truth as you understand it, and you need to speak it to someone who is in a hierarchical position above you.
Mhm.
And speaking truth to power is not a new concept, but in the healthcare industry and public health settings, I think we haven't always been as open about how that can be done without getting into a career-limiting situation, and how it can be done to be respectful of the person who's listening and also help you keep your integrity. I think, as was mentioned earlier, Holly, I think you said it, these are things that do not happen with immediate development of a person. Sometimes it does take some time and practice.
Mm.
Sometimes there does need to be experience, and there might even be some pain along the way before the speaking truth to power concept should be approached. These are some of the things that I think of when I think about hoping for somebody to be the best that she or he can be in a leadership or in any situation in MCH or in public health.
You know, following up on that, it's sort of a little bit, to me, sort of, and my approach, it may be oversimplified, you know, from the books too much, but that people development is really about principles and ideas and beliefs more than tools and techniques. You know, there are tools and techniques that go along working with other people and supervising them and so forth. But to me, people development is about, and the ethics comes into that, you know, as a part of that, but a belief that, or an assertion, a belief that you share among the people that you're with, that it's the people that's, you know, the people are important, and the
Right.
rest will follow. You know, people will perform if the investment is in the people, you know.
Yeah, absolutely.
And there's, it's very rare, it happens, but it's very rare when there, you know, people who work with you don't step to the plate or can't step to the
Right.
plate, or the fit is bad, or the timing is bad, and those are, you know, not bad people, it's situations that are, you know, and sort of dealing with it that way. And I think if you firmly believe that, a whole lot of the rest just sort of
Falls out of it, yeah.
Yeah.
I mean, I think it's almost, you know, I used to think it was a cliche when people say, you know, it's all about the people, but it's true. I mean, when you look, especially at maternal and child health or public health in general, in terms of what our biggest asset is, it's people. I mean, we don't make a lot of stuff, and, you know, we don't have a factory with huge investments in capital. Our capital is in our people, and that's why I think why people development is such a big piece for public health, and especially for maternal and child health. And it's amazing to see how many people don't realize that and expect great things but don't invest in the people or in their building their teams or in systems that don't allow people to develop and in fact may do the opposite.